Dean, we are back with more end user data.
Yes.
Straight from the top healthcare leaders.
Yes.
Acute care, long-term, specialty services, many more. We asked about mobility. We asked about collaboration, connectivity, a lot more than that too.
Holy moly.
So today we're exploring a few of those key findings. But instead of listening to us babble, just a couple
Which
dudes,
would be nonsensical.
A couple dudes that have to go to the doctor from time to time.
Yeah.
We're going to actually talk to an actual healthcare expert.
Oh, thank the Lord.
Yes.
Okay, good. Yeah.
We have Zebra's Healthcare.
I can't punt like in healthcare. No.
We have Zebra's Healthcare Industry Principal, Kassaundra McKnight-Young, joining us today.
Nice.
She's going to share her thoughts on enterprise versus consumer devices. Yep. I know what side we all land on.
Yep.
But we're going to get some more feedback from her there. Communication between departments, what really makes healthcare, who really makes healthcare tech purchasing decisions, how Zebra is helping folks go out there and win some business in this market.
Yep.
Pretty important stuff, I'd say.
Yep.
So
I thought she was a wealth of information, by the way.
She was very much so. You're going to enjoy this conversation. That's why I'm
100%.
glad we're doing our intros after the conversation now.
Yes.
Because I feel like I can confidently say, like, hey, this was an amazing
This was
talk.
very good, yeah.
We
get, like, she gets down into the weeds of what's going on in healthcare. Oh, yeah. Good stuff.
Yeah,
Good stuff.
if you're in that space, you're going to want to listen to this one. I'm John Martin.
I'm Dean Reverman.
We'll be your care team today. Welcome to BlueStar Nation. This episode of BlueStar Nation is brought to you by Zebra. Keep healthcare staff connected for better care with the newest Zebra rugged healthcare mobile computers, the HC25 and the HC55. Well, you know, this is a timely ad given this conversation that
That's right.
we're about to have. And you're going to understand why Zebra
have no idea.
knows their stuff.
That's right. How important this is.
Stuff, yeah. As Zebra's thinnest and lightest models, the HC25 and 55 provide the perfect balance of ergonomics, features, and cost. Both devices support 5G, Wi-Fi 6, and on the HC25 and Wi-Fi 6E for the HC55. I'm going to be honest, I don't know the difference between those two.
Oh, they're important.
But I'm sure that's important.
That's right.
Keeping workers seamlessly connected inside, outside, traveling to patients and around facilities, enabling clinical collaboration using high-speed private and hybrid 5G systems. They're disinfectant ready. I mean, if you better not be selling a healthcare device not disinfectant ready at this point. Exactly. Emergency alert buttons. You're going to hear Kassaundra talking a little bit about that in today's conversation. How important that is. Expanded memory, integrated scanners, hot swap capability. She's going to talk about that too. The HC25 and 55 are ready for every healthcare workflow and setting. Check out the show notes to learn even more and reach out to a BlueStar representative for pricing and availability. BlueStar Nation is brought to you by ELO and their Quick Ship program.
Quick Ship.
Delivering expedited deliveries of select Intel-based all-in-one touchscreen computers. So the Quick Ship initiative, I'm going to say that right, hopefully not botch that too many more times here. Or we might have to put might have to put the explicit, content on this episode if I keep messing it up. The Quick Ship initiative promises readily available inventory of ELO POS and iSeries 2 models with various processors, memory, and storage options. Additionally, they include Celeron models in the program at reduced prices. ELO will ship applicable SKUs to BlueStar within 10 business days. Check out the link in the show notes for a list of eligible products. The Quick Ship program is limited to North America and Latin America in quantities of 20 units or less. Contact the BlueStar ELO team with any questions. All right, our guest today is Kassaundra McKnight-Young. She is the healthcare CNIO industry principal for Zebra. And you hear that title and you think, all right, this is somebody that clearly knows this industry.
Yes.
And like I mentioned up front today, I'm glad that we have someone on the show to talk through this survey with us that actually knows this industry. So it's not just us.
You and I don't live in this industry.
Us goobers trying to make sense of this data.
Yeah. Now, what does this all mean? Yeah.
Exactly. So Kassaundra, thanks so much for joining us. Welcome to the show. Hey, tell us a little bit more about yourself and your background, with healthcare and at Zebra.
Thank you for having me. It's such a pleasure to have the opportunity to speak with you guys about one of my favorite topics, which is clinical mobility. Great job on the survey, too. I was reading through it, and it really looks really well. And you all really delved into a lot of industry. So I'm really looking forward to us delving into that actual conversation. Yes, I am, of course, a nurse by background. I have spent the last 16 years working at a Midwest hospital here in Kansas City, Missouri. Go Chiefs! And I am Also, I mean, I work for Zebra now, but I've been a fan of Zebra for a long time. We implemented one of their flagship devices back in 2016. And so really started our journey on mobility. And we'll talk more about that as we're in our actual conversation. My background is a nurse. I've been in healthcare for over 30 years, first starting in lab scene. So have always been involved with trying to do the right thing to really help drive positive patient outcomes. So, and then I still am a PRN nurse as well. So I still work the floor and have been doing that again for the last 16 years. I have had to take a step back over this last year working with zebras, but I still do utilization management, of course. I do that every other weekend here in Kansas City, behavioral health, cardiac telemetry, med surge. So those are my specialties.
Wow, the perfect person
no
for
doubt.
this. Boy, you really teed this up well.
Yeah.
She's got it all. Now, we won't hold the Kansas City thing against you because, being Bengals fans and all, but,
she's got a lot more to brag about than we do.
She's got a heck of a lot more to brag about than we do. That's what I'm saying.
All right, well, let's get into this then, because obviously you got the know-how here, and I'm glad to have your expertise to kind of comment on what we found out of this survey and what it all means. So, again, for folks, check out the link in the show notes, check out the survey, follow along. There's a lot more stuff in there that we're going to cover here, but it's really good data. So first thing I want to kick off is we found that like 72% of respondents said that they were using consumer devices exclusively or at least some of the time for their day-to-day work. Is that simply a reality we have to face at this point? Because I feel like we've done these surveys and I've looked up this data in the past, and I always see the same thing of like there's still a lot of consumer devices out there in the healthcare world. Is there opportunity still to shift folks over to enterprise only, or are we just kind of stuck in this place where the consumer devices are just going to be out there?
You know what? There is opportunity, and it's a must. What I really understand and see out there is a lot of organizations and a lot of users just don't know what they don't know. Consumer devices are great to be used in the consumer space, but when you come to healthcare, you have to have the device that is really going to help you get to the highest level of clinical mobility. It's also driving the greatest and the best patient care outcomes that you're looking for. And a consumer device can't do that. And when you are actually in this space or when I go out into the hospitals to see, all I see is a lot of consumer devices coupled with a lot of extra technology. And that's what we don't need. We don't need 20 and 30 pieces of technology to get our job done. You all know, I know, everybody knows that there's a nursing shortage. I think I read a survey recently that 18.4% of people who come into nursing their first year are leaving. And it's because of burnout. Yeah. And I was just talking to somebody the other day. What nurse that would spend all that money to go to school, all those clinicals, and take that hard NCLEX to just give it up after a year? And they're not just leaving to find other jobs in healthcare. They're leaving healthcare altogether and they're driving trucks. I was at an event, and one survey revealed that we're leaving customer-facing jobs. So there is a space. And I think what I think is that people don't know what's out there. They think that the consumer device is their only choice. Most of the time when I have a conversation with somebody about mobility and what, an enterprise mobility device can do for them, the definition and the story definitely changes. And then mobility, some people think mobility is actually making a phone call. If that's all you think mobility is, then I have a lot to talk about.
There's some perception issues we've got to get over there.
Yes. Yeah.
Maybe let's dive into a couple things there, because you're right. I mean, we've been talking a lot, on this show and otherwise around consumer devices and some of the pitfalls that come with that. There's the cost of that. There's the perception that, these consumer devices cost less on the upfront, so therefore it's a viable resource. And it's like, well, no, you're going to be paying for that because it doesn't have a lot of the functionality. There's battery life, there's durability issues, things like that. But the biggest one for me, and Kassaundra, I'd like to hear your take on this, is security. A lot of these healthcare entities are very, very concerned around security, and I'll use some acronyms that I don't know, like HIPAA compliance and stuff like that. But you hear how it's you need to have compliance and security. I would think almost that alone, and being able to lock down the device, and when you have these mobile devices that you can do so many things. The IT folks want to know where they are and want to be able to lock them down, right? I mean, you would think that alone would be a good reason.
Yeah, you think that alone would be a good reason, but it's not the only thing. I think that, even with consumer devices, they are doing some work to help, prevent things like cybersecurity. And it does keep the IT departments on their toes, right? More on their toes than they probably really want to be, right? But you're right. That is a challenge, and that would be something absolutely that would want to steer me from that space. So I don't want to just scale over the security issue. Is huge. It's the hugest piece. I was involved with a ransomware in my hospital a few years ago. So very important. And that is a challenge and one of the concerns of most organizations. But just even from that, not just talking about the security piece, it's everything else that sometimes you can't get alerts. It's really the whole mobility piece and what you can actually do with a consumer device. When you said cost, let's talk about what the total cost of ownership. With a consumer device, you can't share that device. So you have to have a device for every person in your organization that needs a mobile device. You're paying for additional licenses for that device, the case that you're paying for, scan engines. It's so the actual care of that, if it's, whatever the brand you're using, you need a care package to take care of that if it's damaged. So there's a lot of things. And then when you think about a non-consumer device, like, enterprise mobile computing device, the life cycle may be 8 years versus 2 years. So it's really, people say they can't afford devices or enterprise mobile devices, but you really cannot not afford them because you're really spending a lot more money because you're refreshing a lot sooner. Theft. Let me tell you something. I mean, ain't nobody gonna steal, these enterprise mobile computer devices. They can't do anything with them, right?
Right.
I mean, people are losing them. I was looking at the survey, but they're probably just misplaced within their organization. But when you talk about a consumer device, you know how many times I leave my device in the room. I should. Okay. But
it happens.
Yeah, exactly. If I had a consumer device, which I don't, in the hospital I work at, we don't. That would have picked up legs and walked out of their room 5 times. They would have had me in the office saying, you have lost too many devices. So, lost in just the replacing of lost devices is huge. But functionality is really for me. Functionality is why I do what I do now, is what I did at my old place of employment. Is really what can a enterprise device offer you versus a consumer device.
I was just going to say, let's dive in a little bit there, because obviously you've been a practitioner now for years, and you've seen the mobility kind of come into the space, and now the demands of the job. Comment a little bit. I love that your phrase is mobility is more than just making a phone call, right? It's way more than that. These devices can do so much more. What are you seeing them do? I mean, we hear things like alerts. Maybe there's a sepsis alert or something like that. And now, no matter where you are on your mobile device, you get that alert. You as the practitioner or the clinician can react to that. Right? So the world of the nurses and just healthcare in general needs to be mobilized in order to, I would assume, be reactionary to these types of things. Is that what we're talking here?
You know what? We could talk about this for days. I love this. This is my favorite topic, truly. I have this saying, I'm going to share this with you. I have 99 problems, but workflow efficiency is not one of them. And the reason is that it's because of the mobility platform.
Okay.
I said earlier that when I talked to people and I said, do you have clinical mobility? They was like, yeah, we have an iPhone. And I said, what are you doing on it? I'm sorry. We have a phone that we're using in our facility.
Right.
And I say, what are you doing with it? And they said, oh, well, we make phone calls and we scan medications. And I said, oh, okay. And she said, but our nurses don't really want to use it. Yeah, because I wouldn't use it because what you've handed me is a paperweight.
Yeah, I see.
So you've handed me a paperwork to do my job on top of everything else that I have going on. So there's so much you can do. So I'm just going to tell you a little bit about the story of the hospital that I work in and what we did do and why this is such a passion of mine. And it was really because of, now 10 years ago, 11 years ago, if you would have told me as a nurse that I could take a enterprise mobile device and I can do everything that I need to do on a device, on a mobile device, on my hip to help take care of my patients, I wouldn't have believed you. I wouldn't have believed you. At the hospital I work at, we used to use 5 devices to do our job. I needed a phone, a desktop phone that we didn't have. We didn't have our own mobile phone, so a phone and a desktop. A computer, you still need a computer, but you're not tied to it.
Right.
I used a camera to actually take pictures. A camera that was shared among 15 people. So how often do you think I actually had that camera or could find that camera when I actually needed it?
Yeah.
And then the process didn't make sense. You have to take a picture after you've located film and batteries. You have to print that picture down. You have to put it on a piece of paper and then label it and wait till it gets scanned into a system. That's inefficient. And the actuality that actually happening, it probably happened, but it probably delayed. And it probably was a delay or not happening at all. And by the time it did happen, if a patient came in with a hospital, that came in with a wound or injury already, if we did not document that within the first 24 hours, the hospital is charged with that care. So hospital acquired pressure injury. So, financial obligations that are tied to workflow inefficiencies. And so that's one of them. A pager. I mean, I know people are still using pagers. I know that.
I've heard, yes. The healthcare doctors still have them, nurses still have them. What's going on with that?
Well, all I know is the Detroit Police Department was the first organization that used pagers back in, I believe, 1949. I mean, okay, we need to really let them go.
Yeah.
We need to let them go. I know that they're using them because they think they're reliable.
Yeah, I see.
But I have a situation where our sepsis alerts, which goes through our pager system, guess what? Didn't go through. Didn't go through one time. It definitely went through my enterprise mobile device I had. Absolutely. So there is so much you can do with it. So we talked about, and with that, let's talk about the actual workflows you can do it. Because most people they know you can do medication scanning. They know you can do lab scanning, and make phone calls. I see that. And then you see some alerts, but what type of alerts are coming through? So this is what I when I think about mobility, there's 20, 25 plus workflows you could actually do. And really the workflows you do should really help clean up the noise. I talk about this noise all the time because nurses, we went to school to take care of patients. That's what we want to do. What we don't want to do is take care of all the extra noise around. I don't know why bladder scanners must cost a lot of money. They have to cost a lot of money because most hospitals have 1 or 2. So currently, this is the experience in most places. A doctor puts an order in for a bladder scanner, and a bladder scanner is something that you want to scan a patient's bladder to see how much urine they're retaining. And usually you're doing that because the patient is having some kind of discomfort and you're going to get an order to actually relieve that patient. But before you do that, you have to understand where the patient's baseline is. So I have to get on the phone and I call and I say, hey, do you know where the bladder scanner is? And then they say, yeah, the bladder scanner is room 345. So I am on the 4th floor. So I have to leave my floor. So I leave my floor. I leave the patient that needs me, plus my other 5 patients I have, to leave the floor to go to room 345. And guess what? When I get to 345, do you think that bladder scanner is there?
Nope.
It absolutely is not there. So I'm spending all this time looking for a bladder scanner. So if anybody is using RFID or RTLS in their facility, the first thing I recommend is tag everything that means anything to you, and drop a locator app on your device. And when I need it, all I have to do is type in bladder scan 101 and I go find it. That's the noise.
Brilliant.
That's what I'm talking about.
Yeah,
okay?
I hear you. That's what a great example, though.
Yeah, I feel like we're talking about a lot of like just us as the VAR community and the reseller community, whatever, like getting out there and just doing a better job at explaining
understanding
what these devices can do and how they compare and contrast with the consumer. Like I was looking at the survey, we also asked questions about like top challenges, and then we took that and split it up based on who said they were enterprise only and who said they were consumer or both. And there was some of that stuff that I looked at and go, this should not be happening. Like the lost stolen device thing, for example, 39% more, 39% of the folks on the enterprise side said that was a top challenge versus only 27% on the consumer side. To me, just what you were talking about, where you can track devices, device tracking is simple to do. Or if you have RFID, that shouldn't be a problem. Battery life. We know Zebra's been great at this over the years. All of the device manufacturers have been great about this. We know that enterprise devices are should have better battery life than any consumer device by far. Is it simply that they just don't know that or don't realize that, or because the charging is a little different than just having a random iPhone or Android cord laying around that you can plug into anywhere? So to me, I looked at those challenges and saw them and said, this feels like challenges that people just don't understand what their enterprise devices can actually do, or no one's explained to them what those devices can do. Is that what you're seeing out there? Do you think there's just a misconception about the difference between these devices?
Yeah, well, I was looking at your survey. I was really, I'm not saying your survey is misconstrued. I think people don't know. I think people don't know that they actually have loss of their consumer devices. I mean, I really think that's really it. They just think they're there, but it's just their belief. Because most of the times when we're talking to people about lost devices and they actually start digging in, it is more than what they actually realize. But I think both on consumer devices and as well as enterprise, you have to have some type of way to track the devices. Because again, even with enterprise mobility devices, they're probably just in a drawer somewhere. And people don't know it, but there's a couple things. And, I'm Zebra, so I have to talk about just a couple differentiators that we have in Zebra that really can help, but people just don't know. So one thing is that BLE beacon. So we have a BLE beacon on our devices. So even if that dies, you can track that device up to 2 weeks later, up to 10 days. Like that's huge. So even with a dead battery, you can still locate it. So if it's in a drawer, wherever it may be, you can do it. And even with device tracker, you can, track it with one device. You play the hot cold game, or you can actually get a beep, right, that says you're getting closer. But I think the biggest thing with devices versus consumer versus enterprise mobility is the hot swappable battery. Again, and it goes back to what I said earlier. People don't know what they don't know. In a mobility standpoint, we only own 16% of the market. That is, to me, that's low compared to what I know we can do as a organization, and even our wide portfolio, not just from a mobility standpoint of bringing that whole one-stop shop together in your organization. So people don't know that you can just walk up and actually take out a battery and not lose anything. Even if you're in a phone call, I can take that battery off, not lose any of my workflow, and pop another battery in and just continue on. People, that's like that they like, oh, that's foreign to them because
it's like magic.
Right? Like it's magic. Like you can't do that with any type of consumer device. And even if with the consumer device, if it's dead, if it die on you, it's just dead, right?
Dead,
you have to go. You got a charger. You can't swap the battery. You need to go try to find another phone. It's again, that's all noise to me. But with a hot swapper battery, I can stand with you at the bedside, and I can swap the battery right then, and I'm good to go, right? Let's even talk about when you're going to the bedside to print. I got to go back to this noise. So many people don't know, and this is where Zebra is a differentiator, is just tap to pair. If I'm going at the bedside, I'm going to print out. I want to print out labels to collect at the bedside and collect the specimen. I have to search for the printer, attach it. If I'm not using Zebra device and a Zebra printer, or I got to try to scan a label on the side. The label's probably deteriorated because it's been sitting there forever. With Zebra device, Zebra printer, all I have to do is tap the pair, and I can print at the bedside. So do you see how I just cleaned up that clunky process?
Yep.
So that's the noise that we don't like. Like this, all of these things are things that really make our job cumbersome. And what about, this is the best one I really like. I love the tasks that go to nurse to tell the nurse to call somebody and tell them something. Call the doctor to tell them the patient needs to come off the monitor or whatever it be. Why would you do me that like that? You think I got time for that? That's where mobility plays. Run those alerts, run those notifications to the physician or to the social worker, whoever needs to go to. Don't take that task off of me. So those are the types of works that we've done. We absolutely we consults, we've done all those types of work. That's what mobility is. It's really any pain problem you have, how do you solve it? And we solved it. The organization I worked at, using our Zebra platform and device, is we ran it through our mobile devices.
It's so critical because you brought up labor early on in this discussion, and I just tie it right back to that, right? I mean, when you have all these young folks that are coming out, and did you say you had an 18% attrition rate or something close to that?
18.4.
Oh, my Lord. Dropping out. I mean,
entirely
because there's obviously frustration and stuff like that where technology can help, and I think you're painting a beautiful picture in my mind about how this technology can enable that. And when you're a younger worker, you want to work in those kinds of situations. We talk about that in manufacturing or even in retail. If you're working retail, you want to have the latest technology to help.
It's got to at least be as cool, if not cooler, than what you have at home.
Right? Well, yeah, at least. And Kassaundra's painting a world where, these devices truly do enable, better healthcare at the end of the road, which is what nursing practitioners are all trying to do at the and get rid of the noise. Love it. Get rid of the noise.
Yeah. Another thing about that too is that we're all facing this in all industries. But why it's so important in healthcare is this, because we're taking care of people's lives. But not only we're facing shortages, but it's really the skilled, unskilled nurse, the experience, because people are leaving at a rapid rate, and the retirement, the aging workforce that we have. In every baby boomers, they trying to get home and cross their legs, right?
That's right.
And kick it back, right? So we don't have that mentorship that we had in leadership in nursing anymore. And so you need technology to really help guide and train. Again, if you have a question or if I need something quickly, how great it is for me to just look at my device and watch a video or whatever it is to help me give and provide better care. So it's really not just about doing the workflows. It's really about having technology to really help you close that gap. Because we're not just dealing with the shortage, we're dealing with that unskilled or the lack of experience that we used to have in this field.
You've mentioned communication gaps kind of happening here and there, and how that's been difficult when, if you're not doing the proper devices, not using the proper devices. Collaboration, communication, that was an important question that we asked in here. 27% felt that there was frequent and seamless communication between their teams, but over half said that it could be better. They thought that communication, collaboration between departments could be much better. Tell us some other things that are happening there. How can we help? How do these enterprise mobility devices help make that communication and collaboration work better?
You know what? I do have to say and speak about the communication. I got to tell you a story before we get into that. The hospital I work at, we started with our device, but we only talk to each other. We only talk to each nurse. Like, we didn't tell the physicians about this new product we had. We didn't tell the social work. We didn't tell anybody. I don't know who we thought we were going to talk to, just each other. So after a couple years trying to improve our communication platform, we expanded it. So our first project we did was really honing in of how to communicate with the physician. And so that was like the bright light bulb, I'm going to say, of communication for us. So you see people always communicating with the physician and the nurse. Like, that's, everybody does that, right? But what about the other care teams that's involved? So PTOT, social work, case management, pharmacy, EVS, transport. But what about dietary? A lot of people they leave out dietary. But you know what the most dietary processes are right now? Is if I have an order change for a patient, diet order, I have to call dietary and say, hey, we got this order change, or we got a new patient, we need another tray. Again, what did I tell y'all that was called?
Noise.
Noise. Absolutely. Absolutely, that's noise.
I thought you were going to go with the whiteboard in the room that you had to go ahead.
Yeah, but you know what makes sense to me? I would use my EHR, and any diet order change, it would go directly to the dietary worker.
It makes sense. Yep.
Most people, but you know what? Most people that forgot about their dietary team. And, do you absolutely need, I'm going to say, a full service mobile device? You don't to do that. You could use a standalone badge to do that, where those workers don't need that full capability. But yeah, I mean, it's so many different workflows you can do for communication. So when people talk about seamless communication, they're probably just talking about that doctor to nurse communication, but there is a broader spectrum that looks at that. And also, when you talk about communication, what type of communication? Not just phone calls. When you mention alerts, I have to stop there, because what I'm going to tell you when it talks about alerting or any type of manual process, let's just talk about that. Any manual process in the healthcare organization is a risk. Any manual process you have, it is a risk. Let's just talk about alerts, for example. Let's talk about telestrips. Let's talk about dysrhythmias. Most of the times when you think about a dysrhythmia, they say, well, we have a central monitoring station, and we have humans who watch the central monitoring station, and they contact the appropriate parties to let them know that the patient is having a dysrhythmia. That's good. I want you to keep your central monitoring stations. That's great. Let's just say this. Do you all understand what asystole is? Do y'all know what asystole is?
No.
Oh, your heart stopped.
Oh, no. Okay.
Okay.
Yeah.
I get that.
Okay. I'm going to say normally, I'm going to guess, this is me saying this. I would think from my experience in the hospital, whenever asystole happens, 98% of the time it's probably a false alarm. Leads are off, when they're reading it, right. Battery's dead, something like that. They're not getting a rhythm. And so, what do you think happens? Like the boy that cried wolves. If they're getting the asystole, they just kind of keep clicking.
That's
clicking
right.
that off because it's not true, right?
Right.
What about the one time that it's true?
Yeah.
Okay. And you're depending on somebody who's watching the monitor do that. They've clicked it. And let me just tell you this hypothetically. So somebody sits there for 10 minutes without any help until a nurse walks in a room, and that patient was not being coded, didn't even know. Happened at shift change. You ought to look at the statistics of the deterioration of a patient. What happens at shift change, because of people are so busy and that communication is not happening, or we made a phone call. Yep. And so, could you save that patient's life? I really don't know if you can really save that patient's life, but what I'm telling you, you're not giving that patient a chance, and you're not giving me a chance as a nurse. Because what really makes sense to me is let that alerts come to my hip. Let me look at it. Let me make the decision I went to school for this, right? It's my scope of practice, right? Let me do that. It still can go to the tele room too, but give me a chance to give that patient a chance. And we're not doing that. In healthcare, we want to be reactive. I'm not about being reactive. We got to be more proactive. And we can't leave this conversation without talking about duress. I don't think we talked about staff safety in your survey per se, but look at the news. Murder, we're being beat. Healthcare workers are the number one profession being attacked. A survey revealed that even compared to first responders like police officers and fire. We cannot not leave this conversation without talking about staff duress. Some hospitals don't have anything. Some people have a whistle. Some a whistle. Do you know how many bells and whistles happen at in an organization? If you blow a whistle, I'm just thinking it's a part of the normal
what's that? All right, whatever.
Noise, right? Normal day-to-day noise. But you have to have solutions that really can help. And again, that's one of our platforms that we do with our mobile devices. So we talk about mobility, where I can push a button. I can push a button discreetly that can call for help, that can go outside, internal, but also outside, working with the ISV partner, can go outside, letting the police, external police, know where I am in the hospital exactly, letting them know within, and as you all may not know this, but we just released our badge here at HIMSS in March. And that's another part of our innovation, is really doing a wake word. If I can't get to a panic button, I can't touch my device, where I can use a secret wake word and can call for help.
Wow. I see.
That's awesome. That's what innovation is. That's what mobility is. That's one of the platforms. So mobility for me is not just workflows. It's workflow optimization, but it's also looking at things in a holistic view. The whole patient, the whole staff member, the whole healthcare ecosystem, and helping organizations work at the speed of healthcare. Not at the speed of the device or anything like that, but really working at the speed of healthcare.
Well said. Yeah.
One of the things I wanted to call out in the article, that we spoke to Cindy Loringer, one of our healthcare consultants, and showed her the data. And I like that she pointed out when she was talking about collaboration. She says collaboration is not just sending texts, emails, phone communications. It also includes sharing a patient's status in real time. And she mentioned that during the shift changes, things can happen. There's a lot of stuff getting exchanged verbally, and that's not always a great way of keeping track of information. And she mentioned also, and this is something you were talking about the whiteboard earlier. And I know this is something that Zebra's also working on and exploring, is they've been partnering up with some new partners in like the digital signage space to digitize the whiteboard, turn that into an actual digital display instead. And I remember thinking to myself, the last time I was in the hospital, the last couple times I've been there, either for myself or for, as a visitor, that whiteboard is still the thing, it's still someone coming in and scrolling on there, and hopefully you can read what they're writing, and that's how you figure out what your nurse's name is and what's going on. The next person has to come in there, and hopefully they can decipher and understand that. So even something as simple as digitizing that, and there's something else Zebra's working on, is like the outside the patient door, doing some digitization there. If you look at most hospitals now, they've just got those little flag things that they turn to indicate, what kind of patient it is, what their situation is, whether it's high risk or something like that. Why shouldn't that be on a digital display that, again, would then be connected to all these devices, connected back to the nursing station, quick and rapid updates and changes? To me, this all makes sense. As you said, the speed of healthcare, it's fast. It's, if we're going to keep people alive, you've got to get information as quickly as possible. You don't have time for things to slow down and print something out or make a phone call to someone who has to make another phone call. So I'm glad we're having this conversation. I think this is going to be an important part of how we can maybe help some folks make that leap to the enterprise and mobility devices by helping them understand just how vital this actually is to patient care, right?
Yeah. And John, I think everything that you just said, what really resonated with me as you were speaking, is really engaging the patient. Like, the patient is part of the team, right? We're supposed to be collaborative with them instead of going in dictating the care. We should be doing that with them. And everything that you mentioned, the digitized whiteboards that are coming out, electronic whiteboards, all those types of things allow the patient to be more engaged. They see who's coming in their room. They know who they are. They know their name. They know their role while they're there. But also we, even with our Workstation Connect, we haven't talked about that. We haven't talked about that with mobility. I said you still need the actual desktop to do documentation, but what, Zebra, with our Workstation Connect, we can drop our devices into a cradle, a dumb cart, I'm going to say, that just has a monitor on it, a scanner if you want it, and a keyboard that can allow you to do full documentation. It's not a screen mirror. So really, I do have a computer in my pocket. There's surveys out there that says nurses are spending anywhere from 28% up to 41% of their time documenting. That's almost half the time. And that's not even all the other things that I need to get done. So how are we providing safe care really, when we have nursing shortage, you have increased workload. Staffing. I used to work the floor, and I used to get 3 patients. That was my ratio. I can go in here now and expect that I'm going to have 6 patients, and sick patient with a high acuity. You understand what I'm saying? They're sick, more comorbidities. So all those different things. So you are wanting me to do so much more with so much less, and this is the thing. Those are the noise, and then we talked about cost earlier. People say they can't afford technology. You can't afford not to have technology. But I mean, what does WOWs cost? You can really reduce your WOW footprint when you think about that as actually being able to, you don't need those WOWs. You don't need as many WOWs if you want to reduce that footprint to be able to drop a device into a dumb station basically and make it smart, right, to do whatever you need to do.
Yeah. And maybe that gets into the whole, how do we implement these things? Because and part of the survey is you made a note of IT being involved in it. What was the question?
So I mean, we asked folks, because I always think it's important. I know healthcare is one of those industries where it's so difficult to find the right people and
the
talk
decision
to the right
maker.
people.
Like, how do you get
the decision maker, getting an opportunity off the ground, and especially because it's a highly competitive industry. Let's be honest. Everyone wants a piece of the healthcare pie.
Everybody's knocking on the door.
Yeah. And so 33% of respondents said that technology purchase decisions were made by committee, and a combined 49% said it was themselves or executive management. A lot of folks we talked to were executive management. But the IT side of things, we did ask, like, hey, is IT the sole decision maker for any of these purchases? And not a single person said that, which I think we should have assumed as much. But at the same time, I also know that there are VARs sometimes that think like, well, if I just work with the IT folks, I'll get what I need. And that's not going to cut it here in healthcare, right? So what does that say about our approach to healthcare opportunities? Who should we be going out there and talking to, and how should we approach them differently than maybe someone who maybe also works like in supply chain or retail or something? If they want to get into healthcare, how does that differ from those other industries?
I think, especially with healthcare, you have to have everybody at the table. And you mentioned, of course, you wouldn't just go to IT. Even though in some organizations they may be, going to IT first and they're making the decision and then only sharing that particular device with them and not giving them other opportunities to look into other things. But you have to have the right people everybody has to be at the table, from IT, from the clinical perspective, supply chain, champions from every industry, every department within organization. You just can't, because one thing I know from my experience is even though you may first go into an organization and you're looking into just the mobility for nursing, it's a bigger picture. It's bigger than just nursing. And how does those other workflows actually integrate into nursing? Because we talk to everybody.
Yeah, that's right.
When we have to discharge. I mean, so to go in there and get in this silo makes no sense. But another thing I'm really seeing out here in the industry, and we talk about this in with my colleagues, is the reason why the organization I came from was so successful, and we had amazing return on investment in our launch with the Zebra product in the platform, is because of, I'm not going to say me, but people like me. Like, I am an informaticist by training. I'm certified. I'm mastered in this specialty. You don't have to be, though. I wasn't. I did this for 5 years before I went to get my specialty. But what I'm saying is you have to have people who understand the needs of the organization from the end user perspective. And so a lot of organizations either don't have a role like an informaticist. And what I'm telling you is I've seen implementations and they have gone awry. And it's because what you just said, you don't have the right people at the table and you don't have everybody you need. So with technology, you have to do that. Now, organizations did invest in informaticists back in 2009 when they were getting the EHRs. We were moving from the paper to EHRs. And then they were like, oh, we got EHR, so now we don't need them anymore. Wrong. You need us. You need us because you need it for workflow optimization. You need it for technology. You need it to understand what makes sense. When people ask me about a consumer device in a healthcare space and would I ever use a consumer device, I wish I would. I wish I would use a device where I don't have an embedded scanner for a workflow that I may have 30 minutes to scan. and you want me to do an image capture, and you wonder why people are not doing it, or I'm dependent on. I have not used a workstation on wheels since 2017. I haven't myself. I use my handheld device, and then I go back and I just don't use a workstation on wheel. I use a desktop to do my full documentation outside of the patient's room, right? And so again, you have to have the right people at the table. I can't, and you have to figure out what that is to actually implement technology. So you have to have IT at the table. You have to have your clinical people, but you also have to have a liaison like me who can speak IT to a certain point and understand clinically and really help drive, regulation, patient outcomes, looking at the whole big picture. So you have to have us.
Yep, I agree with that. And we talk a lot about solution selling and leading with outcomes, not just talking specs to the IT folks. You need to build a consensus, right, across all these roles, which is abundantly apparent now in this role. If you just have a buddy in the IT department, you think you're going to win, it doesn't sound like it's going to happen.
Or, even if you did, you wouldn't be making the folks on the other end very happy. That would not probably suit what the clinicians
they're not going to get the right product or the right tool that they need.
Exactly.
I
think my lesson here is you need a Kassaundra on your team.
Clearly.
I don't know. I don't think cloning is quite to the point we need it yet to get as many Kassandras out there as possible, but find one somewhere or get in touch with Cassandra. And if she's got the time, maybe she'll help you out too. But you need that kind of person on your team.
Yeah, that's true. And if people, if they go with our mobile platform with Zebra, they do get me. They can ask me any question they want.
There you go.
I'm definitely here to help and support because I'm trying to help drive successes. I think it disheartens me when I am called into an organization and they say, well, we got 18,000 phones that we bought and they're just sitting here.
Yeah, right.
Yeah. Because
what a waste.
What a waste. And so, and I don't want to smooth over too. I didn't mention partners. You have to have the right partners when you think about implementing technology. So it's not just about the people within your organization. It's the EHR. It's also the partners who help bring that technology to you. And so I don't want a partner who just want to sell me anything and they walk out the door.
That's right.
I want strategic partnership. And then that's really what we all need. We need to really work on our strategic partnership with the organizations because everybody has their financial and organizational strategies they're trying to get there, and we all can get there together. But we have to go in with that. So as a partner, if you're just here to sell and that's it, then
right.
We want strategic partnerships and we want to drive successes. And organizations are looking for tangible patient outcomes, return on investment, but not just return on investment. That's going to give our dollars. But what about return on life? What about patient satisfaction, nurse satisfaction, retention rates, all of that really helps. And that's what technology really can help us do. It has to help us change it. So what I see out there is, they talk about technological debt, but I just see a lot of misuse of technology. You bought stuff, it's just out there, and you really can actually take some of that money you're wasting and put it back into the technology that you actually need.
Partnerships are so key.
It is.
And when I take a step back and think about the gravity around, this is healthcare we're talking about. We're talking about people's health.
Exactly. There's too much at stake to just go in and drop off a device and think that's all you need to do. It's not that simple.
Yeah. I mean, so that ecosystem's really critical and buying into that and having good partners. I mean, we talk about that a lot, but man, does that ring true here? Because, you need somebody that you can lean on who's going to be there the next day. Not just a flash in the pan or they're trying to sell something real hot, real quick. This is long-term stuff.
Yeah, exactly.
So, anyway.
It is. And I think the key with the both of that, what you're saying is the reason why is I don't want to give the illusion that technology is perfect.
No.
Y'all know it's not perfect.
That's right. No.
That's it. Problems are going to happen. And that's why you need to have a strategic partnership. Because when they do happen, and you've been to one hospital, every hospital is different. Everybody's need is different.
I'm sure.
So something that worked one place may not work somewhere else. So you have to have strategic partnership, and you have to have partners that are willing to go in and do the work and have not just their own goals, but that organization's goals as their priority.
Yeah, good stuff. Yep.
All right. Well, in a moment, Kassaundra's going to give us her final thoughts on the survey and how Zebra is helping you go out and win some business in healthcare.
Yes.
Before we do that, let's talk about what's happening around BlueStar Nation. Well, if you're listening to this podcast, you know that we make some great content.
We do.
I hope that you listen to this and think it's great content.
The survey. Yes.
Mostly because Kassaundra's here today. We've elevated our content a little bit today. But you might be missing some of that great content if you're not subscribed to our BlueStar Nation newsletter.
That's
now, before
true.
you say, nope, I don't need another email. I get too many. Trust me, I get it. I get way too many also. We get it. We only are going to send this newsletter once every 2 months.
Yeah.
So it's 6 times a year. 6 emails a year is all you're going to get from us when you're subscribed to this. I can't promise what's going to happen with all the other email you get, but from us, that newsletter,
from
you're
BlueStar
only going to
Nation,
get that 6 times a year. You'll get links to our best new articles.
High quality stuff.
Like today's survey.
High quality stuff.
You get other hot industry, sales, marketing, channel topics, lots of good stuff. You can find out what new hardware and software partners we're working with. Check out the latest unbox videos, so much more in every issue. Check out the link in the show notes to subscribe and get the channel's best content right to your inbox. While you're doing that, take a brief moment to like and subscribe to our show.
Why not?
Follow us on YouTube.
That's
Follow us on whatever podcast platform that you're listening on. If there's an option to leave a comment or a review, please do that. Share it with a colleague or a friend, someone in this space that you think might be interested in what we talked about today. I guarantee if you do work in the healthcare space, you probably want to share this particular conversation and say, hey, did any of this stuff that Kassaundra was saying ring true to you? And they're probably going to say, every single bit of it. Can you help me? And that probably help you get some business. So, and of course, like I said, check out the BlueStar Nation blog. Submit your ideas for the show to us. You can reach out to us, find us anytime on the BlueStar LinkedIn page, or you can email us directly, nation@bluestarinc.com. All right, let's wrap up as always. First, a little VAR value here. And
yes.
Kassaundra, was there any other findings in this survey that really stood out to you? And while you're telling us that, give us also a little bit of insight in how Zebra's going out and helping our reseller community to really go out and tackle these clinical mobility needs.
I think the survey actually was a very good survey. I don't think I had any surprises in the survey other than it seems like that they're losing more or misplacing more of the enterprise devices. That was the only thing I'm going to say. I'm going to say to that, I'm going to say they just don't know that they've lost their consumer devices is what I'm going to say on that. I didn't really see us talk about AI in the survey and ask about that per se. So that's it. You know, AI is the new greatest topic everybody's talking about. There's a lot of vendors out there, but what's really working, right? I've seen a couple things that I really, really like. So I'm just really interested in delving into that. But also from a Zebra perspective, I'm really expecting, can't wait to be able to share what Zebra is going to be doing with AI and platforms and really helping tackle some of the noise that we've been talking about in general is what I'm going to say. It's really reducing that noise and really helping the clinician at the bedside, not just inside the four walls. It's before you get there, when you're there, and after you go home. As we talk about hospital at home. We didn't talk about that specifically today, but I'll be looking forward to talking about that again with you guys. But how we're moving to hospital at home and what does care at the house look like with the family members supporting.
I think Kassaundra just booked herself for another episode. I like it.
Well,
we're always looking for good guests.
But to her point, there's so much to discuss. I mean, we could spend an hour on that alone.
Definitely.
Yeah, for sure.
Anything else stand out to you on that survey?
No, but I appreciate Kassaundra really kind of honing in on some of the things that Zebra can do to help in some of the differentiation, because that is meaningful, right? There is industry expertise that is being brought to bear to try to work on these workflows and to enable this and to use the phrase to cut down on the noise, which is so critical. I mean, come on, what's a more important industry than healthcare, for crying out loud? And cutting through this noise and enabling the people, the clinicians, to do what they went to school to do. You know, which is take care of people. So that's what it's all about.
You know, I think the only other thing on the survey that really stood out to me was the connectivity piece. We asked, about, were there cellular or wireless dead zones in your facility? 28% of people said that there was cellular and wireless.
How does that
zones.
even happen?
That was exactly what I wrote down here. How does it even a thing in 2025, especially in healthcare, where again, every second counts.
Every second.
And if for some reason you need to get a critical, conversation or an alert out or connect with something, in a moment of crisis and you don't have connectivity, what the heck?
Yeah.
So I mean, we've talked a lot about connectivity on here before.
Yeah, we got solutions there.
We're standing up a big, connectivity solution.
That's right.
Jim Hilton with this, I almost feel like he'd be bursting through the door right now to explain, but that's a huge part of this, right?
Yeah, but again, you not having the right people at the table. Maybe they didn't do an accurate Wi-Fi assessment. I've seen it. I mean, like everything. When people talk about they got connectivity issues, I mean, have you checked it lately?
Right. Something so simple as that.
Here's your amazing new device. Oh, by the way, it's pretty much a brick because it doesn't connect to anything in half your facility.
This wing in the building, it doesn't work.
Whoops. All right, good stuff. All right, well, again, go check out the full article on BlueStar Nation.
Yeah, it's a good one.
That's nation at nation.bluestarinc.com for that website to find our full article and all the survey data there. And I have a feeling we're going to be sharing more of that over time too, and trickling that down a little more in the future as well. All right, let's wrap up as always with what's on your radar. This is the fun part of the show. We get to talk about something in the world of innovation, tech, science, the news, business, whatever we feel like talking about.
Something fun. Yeah.
So, Kassaundra, I'll let you kick it off. What's on your radar right now?
Oh my goodness. What's on my radar is what I talked about earlier is staff duress. It's what's on my radar. It's my passion right now because really trying to look at every use case scenario in a clinical space. Active shooter, being chased. What about being choked? What if I am knocked down and my hands are covered? All of those things. So staff duress is what's on my radar. Is something that with everything that's been going on with the recent murders at a hospital, it's really my passion and really trying to figure out that space. So not only can the patient stay safe, but the colleagues that I love and that you all love as well can stay safe in this industry.
Yeah. Just not even something that, I can, it's so important though.
It really is.
Relative.
My wife has been working in the local healthcare space, the big local healthcare system for a while now on the administrative side and HR side. And she has experienced some of these horror stories, has seen what happens. And it's not the kind of thing you think of a hospital, a healthcare space as a place where people go to rest and to get better and to be taken care of. And it's shocking the amount of violence that does occur. And I get, again, part of it obviously is, this is people that are themselves under a lot of duress as patients or people that are concerned about loved ones, but you'd be surprised how often violent acts break out and stressful situations break out. And, you want an example of why the 18% of people are potentially bailing out of this industry. I'm sure, the first time you have an experience where a hostile patient or a patient's family member is assaulting or attacking or threatening someone, like I get why that might be a reason why someone goes, this is not what I signed up for. And I'm glad that there's another great example of why we're using technology to potentially address a problem that is a more fundamental human problem, but technology could potentially help us solve it.
Good Lord. Yeah, for sure. Yeah.
All right, Dean, what's on your radar?
Well, I came across this article and do you ever scratch an itch?
Well, sure.
Do you ever want to figure out why you do that? You think it's like evolutionary type of a thing?
I mean, I see my dog do it a lot too,
Well, I'm not talking about your dog, but anyway. Right. Yeah. And sorry to bring up this topic because I guarantee I'm going to make you now get itchy.
Oh, great. Thanks a lot, Dean.
But the article is around the evolutionary benefits of scratching an itch. So, and believe it or not, this is one of those areas that we haven't, gone through the process of trying to figure it out. But anyway, people are typically advised not to scratch itchy skin because, it can create abrasion,
make things worse,
and make things even worse and stuff like that.
Yeah, good luck.
As it turns out, scratching an itch increases inflammation. So there's a whole reason for it, right? It increases the inflammation and boosts your body's immune response at an itchy injury site, as they say. Now I'm not talking chronic itching type stuff. I'm just talking, normal stuff. So of course they had to go ahead and do a research with some mice around this.
These poor mice.
And I know the poor mice. But they actually engineered, this is where it gets a little freaky. They engineered mice that don't have an itch sensing neuron in their body, right? So they've got this group of mice over here that can't sense an itch, and then they've got normal mice that can sense an itch. Right. And they did the comparisons, blah, blah, blah. At the end of the road, yes, there seems to be some evolutionary benefit to having it. Those mice that could itch themselves had less bacteria. They used this particular thing where they put bacteria on the skin, and then they judged how much bacteria was left after somebody that itched and didn't itch. But apparently there's a whole evolutionary thing to it. So yes, itching is important.
Okay.
It's okay. We've been wired this way
Right,
to make that happen. Yeah.
So it's just telling our bodies like, hey, there's something going on here. You should probably work a little harder to fix it.
That's right. And it creates this inflammation type of response, which then cascades into what they call activates mast cells. And then that triggers something that's called neutrophil or something along those lines, which is it just gets your body ramped up that, hey, if we is there something here to fight is basically what it's asking.
Plus, sometimes a good itch just feels good, you know?
Well, and that, but that was the kind of the beginning of the whole article is around that it clearly, if there was a pleasure sense to it, then evolutionary, there's your incentive to do that, right? We've wired in an incentive that it's a pleasure to do that, so you're going to do it rather than, you don't want to do that. So more than you wanted to know about scratching an itch.
Yeah, I'm not going to lie. I felt the urge to itch myself.
It was my healthcare related one on the radar.
But at least I know it was a positive. This is one of those, sometimes you give me these things, you tell me like there's something horrible at the end of it. Like, oh no, by the way, if you itch too much, you're going to die sooner or something. But this is a positive outcome.
No, it's a positive outcome.
I like this.
So what's on your radar, John?
So, I'm going to get out of the healthcare space as far as possible, get out into the universe.
Oh, there you go. Okay.
So if you didn't have a long enough list of things to worry about in the world, maybe you were worried about the fact that our galaxy might collide with another galaxy at some point.
I saw this in the news.
Because apparently that has been on the agenda. And there was and apparently for the longest time, it's been an almost near certainty that one day the Milky Way and the Andromeda galaxies were going to collide.
We're going to be more than just neighbors.
Apparently, that is no longer as much of a certainty. It's now essentially a 50-50 coin flip.
Oh, wow.
So they're always evaluating new data. In fact, a lot of new data that came from the Hubble telescope and the European Space Agency has a project called Gaia. And essentially, checking out some new data finds that no, it seems more likely that our two galaxies will probably miss each other, and I think if it's something like 500,000 light years or more distance, then there's not going to be a merging or a collision of any sort. Now, granted, this is also a problem that's like 5 billion years in the future.
I was going to say, what's the timing on this? Do I need to worry about this?
No, I kind of have a high doubts that humanity's even still going to be around at that point, frankly. But just in case,
well, 5 billion. I think our sun will be burned up by then.
Yeah, probably. So, I don't know. So there's a chance that this still could happen. It's a 50-50 coin flip. Apparently, we're much more likely that the Large Magellanic Cloud, which is the largest, closest satellite galaxy that kind of revolves around us, that's much more likely to actually merge in with our galaxy at some point in 2 billion years. So
God, isn't this stuff fascinating?
Little bit closer to
the
that.
Scale of this stuff. Billions of years and hundreds of millions of light years. It's like, can't even get your head around.
I was trying to explain to my son the other day, like the scope of just our galaxy alone. And when I was explaining like that our solar system is just one tiny speck of the end of one giant arm of our massive galaxy, and there's hundreds of thousands, probably millions of other similar systems just in our galaxy. Like I could tell him just looking at me like, nope, not getting this one, Daddy.
Cannot compute.
I'm like, to be fair, I don't understand. Sometimes it blows my mind too.
Page.
So so you can take that one off your list of things to be upset and concerned about. I guess we're not anytime soon, or we may not actually collide with another.
It leaves
galaxy.
me scratching my head to go back to mine.
There you go.
Thank you. I can sleep at night now. I can go to sleep at night. Thank you.
There you go. I am glad to do that service and take that worry off of your mind. Yeah.
All right.
Kassaundra McKnight-Young, thank you so much for joining us today.
Thank you,
appreciate
Kassaundra.
having you on the show. Hey, until next time, we gotta send you off. But remember, folks, mobility more than a phone call.
More than a phone call. That's right.
We'll see you out there in the nation.